In a study that's stirring up discussion this morning, researchers have found women are less likely to die or have to return to the hospital if treated by a female doctor, especially if they're severely ill. The study in the Annals of Internal Medicine looked at hospital patients 65 and older who are on Medicare, finding 8.15% of women treated by female doctors died within 30 days, compared to 8.38% of women treated by male doctors. Although the number is small, the authors say that erasing the gap could save 5,000 women's lives each year. Dr. Amy Fiedler was part of what's believed to be the first all-women team to perform a heart transplant.
Whenever we see an impact in mortality, that's something to pay attention to, because the difference of one life to any given person can mean the world to them.
More research is needed, but the study authors suggest female doctors may communicate more effectively and help alleviate embarrassment during sensitive exams. Also noting male doctors may underestimate sickness in female patients. In recent years, women's role in medicine has soared to record levels, making up 38% of physicians in the U.S. in 2022, up nearly 10% from 2008. But there's a long history of sexism in medicine that persists today.
I'll be wearing a white coat and introduce myself as the surgeon. Frequently, I do get misidentified, not as the surgeon, but as a different member of the care team.
How can we improve the environment for female physicians?
I think it's important for young women out there to see that they can do this job and that they should do this job.
Look right at me.
So there are limitations with the study, including its narrow focus on older hospitalized patients who are on Medicare. And remember, a patient's outcome is influenced by multiple factors. But experts say the results underscore the importance of diversity in the field. Guys.
All right, Emily, thanks. Let's bring in NBC medical contributor Dr. Natalie Azar with more of what we need to know. Yeah. I was just thinking as this was going on, I realized that all of my doctors are women. I mean, I just went through in my head. And I think it's the feeling of a female doctor hears you. When you say something, they're not trying to explain it away. Is that really at the nut of this?
Yeah, look, I mean, I think it's sort of this convergence of, miscommunication or misunderstanding and maybe some bias. The researchers basically offer 3 different explanations for why this could be happening. One is that maybe male physicians underestimate illness severity, right? And that can delay appropriate treatment. And the other is that female physicians are more patient-centered when they communicate. What does that mean? It means they're really getting that crucial information that can make such a big difference. And then in terms of that pairing of a female physician with a female patient, issues, urologic issues or gynecologic issues that are so sensitive that women just might feel more comfortable discussing with a female physician. It could really, really impact care down the line.
So this was the study or the survey was focused on older women on Medicare. So it's just a slice of the population. But could this be expanded out to younger women in other care settings?
Right. And that's important. Obviously, they can't generalize to an outpatient setting. They can't generalize to younger patients. I'm sure many physicians out there, myself included, have anecdotes about people saying, maybe I prefer a female physician for that reason. But I think that there are some takeaways. And this is certainly for female physicians, since this is kind of like the focus of this morning's discussion. But I think it applies to any patient out there. What should you be looking for in a doctor? Somebody, obviously, I know this is going to sound intuitive, someone who listens and asks detailed questions. But this is all about time. If you have a doctor coming in and rushing out, they're not able to take a really good detailed history. You want to be able to trust, have a rapport with them. And this is so important. Do they explain things in a way that you understand? Are they using language that you understand? And are they including you in decision making?
I think it's like having the courage to say, this doesn't work for me. I'm going to change. Because I think sometimes you're like, it's the doctor. He knows. And then you take what they offer.
And so I want people to understand that it's okay to go to a different provider. And listen, in some places
in theory,
in the country,
but a lot of if you want them to be on your insurance, sometimes
that or there might
option.
if you have that option. And then the last little pearl I would leave everybody with is bring a buddy with you. Whether it's I've had numerous female patients bringing a male partner, doesn't need to be male, but somebody who can advocate for you and say, no, the patient, you are really experiencing these symptoms. I hate to have to say that because it feels like it shouldn't be necessary.
No, it shouldn't be.
But for women to feel that they're understood in the office, sometimes that helps.
Okay. Well, that's depressing. All right,
I know.
Dr. Azar, thank you.
Thank you.
Hey, thanks for watching. Don't miss the Today Show every weekday at 11 a.m. Eastern, 8 Pacific on our streaming channel, Today All Day. To watch, head to today.com/allday or click the link right here.